Dear colleagues, good evening. Masa Al Khair. I am glad to greet you very much. I'm Professor Vitaliy Kovalchuk. I am the chairman of St. Petersburg Society of Rehabilitation, the head of Center of Rehabilitation, professor of European Academy of Natural Sciences, and professor of Cambridge University, and honored doctor of Russian Federation. For more than 25 years, I have been dealing with the problems of treating the patients with dorsalgia and disorders of musculoskeletal system. And this field of my professional activity is concerned not only practical direction, but also scientific and lecture activity. During every year, I am visiting a lot of countries all over the world with my lectures and master classes. And therefore, for sure, I have the opportunity to observe various achievements of different fields of medicine, including a treatment of patients with back pain and disorders of musculoskeletal system. And for sure, I have opportunity to see the results of using of certain methods of spine treatment. And one of the most brightest examples of such treatments technology is the compression system Robospine by company Mac Brothers. I acquainted the system Robospine 2 years ago and have rather rich experience using of the system in hospital named by Semashka in St. Petersburg, where during 25 years I had rehabilitation center. Patients of our hospital are very different patients with different disorders of a different age, including a lot of age old people with non-active lifestyle. And the system of Robospine is an excellent assistant of a doctor dealing with spinal problems. On one hand, the system can carry out the function of an automated system that does not require high qualifications of the personnel, according to the different programs of Robospine. On another hand, Robospine can also assist very experienced doctors by helping to choose different kinds of system efforts, angles of tones, and impact more accurately and variably. Very delicate and safe system, and an excellent example of the robots and persons collaboration to achieve the best results of the treatment. It's necessary to say some words about the impact of spinal disorders on humans' quality of life and on society in general. 30% of people all over the world are suffering from dorsalgia. 60% of people are suffering from pain in lumbar part of spine. Practically 100% have episode of back pain at least one time during life. A lot of money is spent for back pain treatment. A lot of sick leave is discharged due to back pain. Total loss from temporary and full loss of work activity to back pain are estimated in billions of dollars. Therefore, the spine disorders are very important medical and social problem of modern society. Some words about different kinds of treatment. As we know, there are a lot of kinds of treatment in patients with spine problems and back pain, such as manual therapy, physiotherapy, physical therapy, local injection therapy, using of medicine, and at last surgical methods. And every method has its feature and unfortunately minuses. For example, surgical treatment. There are only two absolute indications for surgical treatment of hernia of intravertebral discs. First one, complete block of liquids dynamic and complete myelographic bulk. And the second one, progressive muscle paresis and pelvic organs disorders. And unfortunately, 95% of discs operations are carried out unreasonably. Besides, there are some complications after surgical operations and necessity of rehabilitation after operations. Treatment that requires follow-up treatment. It's not very good. The next blocks of treatment methods is massage and mild tissue manual therapy. A massage is perhaps not bad method, but not for our patients. Why? Patients with spine disorders have not only increased the muscle tone, but also increased the tone of fascias into which these muscles are enclosed. The usual massage techniques can reduce the tone muscles, yes, but cannot reduce the tone of fascias, increased tone of fascias, and releasing muscles without releasing fascias doesn't work, unfortunately. Therefore, in these cases, it's necessary to use the mild tissue manual therapy. But there are a lot of problems with using manual therapy, such as risk of complications, the problem of finding and choosing the right doctor. There are many who offer manual therapy, and very few who carry out it correctly. For example, there are some rules of manual influence, which are often not maintained by manual therapists, unfortunately. For example, it is necessary to change immediately the direction of movements of our hands at achievement of vascular barrier. It's a basic rule of manual therapy. For example, during manual therapy, there shouldn't be a flick or a crunch. The unique case when we allow a flick is correction of pubic joint. In any another cases, crunch during manual therapy, the indicator of non-professional performance of manual therapy, and so on and so on. Unfortunately, these rules are often not maintained by manual therapists, and this is the reason of efficiency absence, but complications presence. The next kind of treatment, medicines treatment. For sure, we can and we must use medicines in treatment of pain back patients. But there are some complications, some contraindications, impact on pain, but not on its reason and sources. More often it is symptomatic, but not pathogenetic therapy. And we and our patients are needed in pathogenetic therapy. It's very, very important. But how? The main answer on this question is spinal decompression. All the problems of our spine is our retribution for walking upright. Even we do nothing, just sit. Compression loads of blast exert pressure on spine and discs. Therefore, spinal decompression is really very, very important. And we know different systems for spinal decompression that have been used with varying degrees of success, and unfortunately often without any success. And the main demand to the system is safety. And this is the great problem, because using of known systems may lead to different complications. The efficiency absence and complications present urge on specialists and engineering to elaborate effective and safe technique of spinal decompression. This is how the system Robospine was appeared. What are the main features of Robospine? The first and most important thing is safety system, consisting of mechanical and software parts. Robospine doesn't work according to the winch or crane scheme, like most systems, unfortunately, but in the mode of constant monitoring of feedback from the back muscles and spine. Robospine doesn't try to overcome their resistance by the force of electric motors and cables, but interacts with the patients gently and physiologically. The second feature of Robospine, sorry, please, is the convenience of using. Maintaining management is possible by using a touch monitor, using a mobile remote control, using voice instructions, as well as possibility of manual correction of position. The next very important Robospine feature is individual approach to each patient. It's very, very important too. Due to the presence of individual tonics, Robospine has movable cervical, thoracic, and lumbar sections. The cervical section has 8 different directions of movement. The thoracic part has 4 directions, and the lumbar part has 4 directions too. The next important Robospine features is convenience and comfort for patients. Robospine is equipped with a pneumatic fixation system, comfortable for patient and simple for doctor. The monitor, which located above patient, is used for patient's relaxation during procedure. Unlike some other decompression systems, Robospine is compact, lightweight, equipped with the wheels, and can easily be moved to any other room is it necessary. The area occupied by Robospine is only 3 square meters. During 2 years where I used all these advantages of this modern system of spinal decompression, the system of Robospine, with great efficiency in our practice in our rehabilitation center, and no one complications during these 2 years. The great efficiency and no complications. It's very, very important. Thank you very much for your attention. I wish to end my speech with this pithy Latin phrase. It is a divine matter to calm the pain. What all of us are doing and what I wish you do successfully. Thank you very much. Shukran lak. Thank you. Goodbye.